So, ladies and gentlemen, moving ahead with the proceedings of today's function, 6th edition of Rasashastra Sambhasha, I would like to invite Dr. Priyadarshanee Gunarathne. She is an Ayurveda consultant in surgery, currently working for Gampaha Vikramarajchi Ayurveda Teaching Hospital, Yakkala, Sri Lanka. She has done her Masters in Shalyatantra MS from SDM College Ayurveda, Karnataka, India. And Dr. Gunarathne would present her rich clinical experience in successful management of critical wounds with Rasashastra and other Ayurveda medicines. Over to you, madam.
Ayubowan and very good evening to all the dignitaries on the dais and off the dais, and all distinguished guests in the audience and all the participants who are presenting here. I welcome you all for my presentation. So I think you all have experience with wound healing. No one can tell we are not having any experience of wound healing, because while we are birthing itself from the mother, while we are detaching, we are getting a wound. So it is very important to know what is the wound and how it's healing. And especially in India and Sri Lanka, that all girls in Sri Lanka and India, and in India in boys also, they are having Karna Vedana Samskara. Mostly we are thinking that is only for that beauty purpose. No, that is not beauty purpose. It is actually for, we are introducing Agantuja Vrana for the body, and we are giving chance to resolve the wound by itself, because we are normally giving that golden jewelry to the ear or the nose. So because of that, it is very important to talk about wounds. So today I am going to deliver successful management of critical wounds with Rasashastra and other Ayurveda medicines. So this is the topic summary, that introduction of wounds, wounds management, common using medicines, successful stories, summary and conclusion. Then while we are talking introduction of wound, especially in Sushuta Samhita, they are given that it's very painful condition of the life, and most of the wounds appears on the skin. The same time that skin is the largest organ on the body, and wound healing is the major problem for especially surgeons as well as other doctors also. And that especially 3 words they have mentioned in Sushuta. That is Roga called Vrana, that who is having Vrana, they called Rogi, that is Vranita, and where the patient is staying when they are getting wound, that called Vranita Gara. Then stages of wounds. Especially while we are treating for the wound, we have to consider about the stages of wound. That is mostly the Drishta Vrana, that means that is not clear wound, and there is no any progress of wound, mostly it has stopped itself and no any granulation. Then Shuddha Vrana. Then Shuddha Vrana means they are not having slough or pus or any pain or any other symptoms, and they will start to grow the wound. Then it's turned to Vruhyamana Vrana, that is growing wound, and next one is Rudha Vrana, that means almost healed wound. Then what are the basic principles to manage a wound? As a surgeon, it is very important to plan the wound healing first. Then we have to do the Vedana Shamana, Shotahara, Rakta Stambhana, Ropana Karma. Then we have to consider about Patyapatya, and mostly we have to do that prevent recurrence, because lot of patients they are getting the same wound at the same site in various time. Because of that, we have to stop the doing recurrence on the body. Then here I have going to mention, this is Shashtivida Upakrama mentioned by Sushuta Acharya, and the Charaka Acharya has mentioned 36 Upakramas. Here specially I have mentioned because they are having more Upakramas, but I am not going to detail one by one, but we can do a categorization of these Upakramas, what they are going to do with this. Then here that management of Vrana Shofa, they have given some ideas. Then incision and drainage, that means the Shashtivida Upakrama, how we can use while we are doing that Vrana chikitsa, then that cleansing and promoting granulation. For that also they have given some karma, and that other one is set right to wound healing and that Vaikrutapaham. For that 5 categories, normally we can contribute all these 60 kramas. Then while we are treating the wound also, we have to follow the normal protocol of Ayurveda treatments. For that we have to go for Langana karma, then Agni Deepana, Amapachana, Shodhana, Shamana, Tarpana and Rasayana karma. Especially while we are using that Rasayana karma, we can prevent recurrence of wounds. Then what are the common medicines used in Vrana Chikitsa? Then here again I am telling we are not always using all rasa drugs, but we are using that other herbal drugs also. But specially I am going to mention what are the special rasa drugs we can use here. Then Agni Deepana and Pachana, we can use Abraka Bhashma, Kapardika Bhashma, Yasada Bhashma, Agni Kumara Rasa, Agni Tundi Rasa. In here we are using some Sri Lankan drugs also, mostly that Ramabana Rasa, then apart from that Navaratna Kalka, etc. Then Krimihara, especially that most of the patients having some macrocrimi or microcrimi. At that time we have to use Krimihara drugs, especially Trivanga Bhashma and Krimikutara Rasa also we have to use. Then Virechana, especially while we are treating the patients, we have to do the blood purification, if not the Rakta Shodhaka. For that purpose we have to go for Virechana karma. So most of the patients while they are having wounds, they are having associated complaints, mostly they are having chronic constipation or Malabadha. So because of that we have to use that Virechana drugs, mostly we can use Icha Bedi Rasa, then Agni Tundi Rasa, Arogya Vardhani Rasa, etc. Then because of the wounds they may be having pain, then may be having Shota, then may be having Kandu, etc. According to that also we have to give some medications. If the patient is having Daha, then we can use the Chandrakala Rasa, then Punarnava Gugulu, etc. Then Shotahara, especially that lot of patients, if they are having wound, they may be getting Shota. Then at that time we can use Amuttadi Gugulu, Singhada Gugulu, Panchamruta Loha, Gandhaka Rasayana, etc. Then especially that that for Shulahara, because lot of patients having severe pain of their wounds, because of that we have to use that Shulahara drugs. The same time we have to do for that Shotahara treatments also. At that time we can use Trivanga Bhashma, Krimikutara Rasa, Punarnavadi Gugulu, Chandraprabhavadi, etc. Then Jarahara, lot of patients they are having inflammations because of their wounds. So at that time we have to treat for that also. Then Abraka Bhashma, Punarnavadi Gugulu, Gandhaka Rasayana. In here also we are using some kind of Sri Lankan traditional medicines also, some kind of Ayurveda medicines also apart from these. Then Pandu, most of time the patients may be having anemic conditions associated with the wounds. If the patient is not having good hemoglobin count, then the wound will take lot of time or more time to get healed. Because of that we have to prevent the Pandutta stage of their wound. Then for that we can use Yasada Bhashma, Arogya Vardhani Vati, that Punarnava Mandura, etc. Then most of the patients they are having wounds because of their Madhumeha condition, if not they are because of the diabetic conditions, especially diabetic foods and etc. For that also we have to treat the same time. Then we have to give that Trivanga Bhashma, Triphala Gugulu or any other diabetic controlling drugs. That's what again I want to mention. Not only the rasa drugs, that other medications what we are using here, either traditional or Ayurveda medicines, we have to give and we have to cure the diabetic as well. with the wound healing. Then Rakta Shodhana. I told earlier also, if that blood is very good in condition, the wound heal very fast. If not, we have to do the Rakta Shodhana karma also. For that, we have to give Rakta Shodhaka drugs. And other thing is Rakta Stambhana. Some patients, they are coming, especially that cancer wounds, they are coming with lot of bleeding, and some patients, while they are having their Bruhyamana Vrana, they are having bleeding full of the wound. At that time, they will somewhat afraid. So we have to stop the bleeding, and mostly post-op, that means after the surgeries, they may be getting severe bleeding. At that time also, we have to use that Rakta Stambhana drugs, especially we can use Bola Bhaddarasa, then Trivanga Bhashma, then Yashada Bhashma. Likewise, we can give lot of medications. Then Shofahara, that means inflamed wounds. For that also we can give that Amurtadi Guggulu, Kanchanahara Guggulu, then Chandraprabha, then Gandhaka Rasayane, Panchatitta Grata Guggulu, etc. Then Kanduhara, especially that earlier also I told, lot of patients having Kandu while the wound is healing. At that time we have to give some Kanduhara medicines like Amurta Guggulu, Punannavadi Guggulu, Gandhaka Rasayana, etc. Then we are just go and have a look what kind of ingredients we have that we are commonly use, that some kind of rasa drugs. Here I am not going to mention one by one, but you can see in one drug they have lot of ingredients. Because of that lot of ingredients, they may be getting lot of actions. So as previous madams and all said, then from one medicine we can treat for lot of problems in a one time. That means mostly they will time saving also, they will prevent from recurrence also, they will prevent from suffering also. So here also you can see from one drug they are having lot of ingredients as well as lot of actions, and we can use from many conditions. In that Kapardaka Bhashma, especially I want to mention here, apart from these all, with my experience, lot of that Shravi wounds, that means discharging wounds, we can use that Kapardaka Bhashma. Lot of time, because of the Shrava in the wound will take more time to heal the wound. So we have to stop that Shrava, including Rakta Shrava and other all Shrava, that means maybe pus or pus or serous or whatever the Shrava. So at that time we can use Kapardaka Bhashma for the wound also, that means locally, and the internally also we can use Kapardaka Bhashma. Then Trivanga Bhashma. Here also what I have to mention here, that they also having lot of actions. According to the patient's situation and the associated other complaints, we can use all these medications. Then Yashada Bhashma, especially where we can use Yashada Bhashma locally, while the wound had started their granulations. We can stimulate the granulations by putting that Yashada Bhashma on the wound, that means local application. So it is very beneficial treatment for the wound healing. Then Shanka Bhashma, the same as Kapardaka Bhashma previous I mentioned, that Shanka Bhashma also we can use for that Shravi wounds for the local. Apart from these, actually they have given that internal actions, but I am specially mentioned what we can use for that as local medications. Then Kukkutanda Twak Bhashma. This also we are using because some patients having fractures, because of that only they are getting some wounds. If not, maybe they are coming with osteosarcoma. Some patients I got, some having osteomyelitis patients. At that time they are having very we need to do that bone density and all increase. So at that time we can give that Kukkutanda Bhashma specially. Then Mukta Bhashma also we can use for make that bone density correct. That Vanga Bhashma also likewise we can give. Then Agni Kumara Rasa. That previous also we mentioned, most of the patients while they are coming for us, they may be having armor condition in their body. if we are not doing that nirama chikitsa, that medicines will not work on their body or in their body on locally. So, we have to convert that ama patient to the nirama condition. At that time we can use Agni Kumara rasa specially. In that Bolabadda rasa means some patients, I told earlier also, may be having severe bleeding conditions because of post-op conditions or because of some other reasons. At that time we have to stop the bleeding as soon as possible. Because of that we can use that Bolabadda rasa, and it has already Vrana Ropaka and it can enhance the immunity also. Then Agni Tundi rasa also having Deepana Pachana actions. Then Arogya Vardhani Vati also we can use in many aspects. Then Icha Bedi rasa, that also we are using for that virechana purpose, because some patients having very chronic constipation, sometimes they may be having motions for once in a week or once in a month even. At that time we have to use that Icha Bedi rasa and it will work very nicely. Then Krimikitara rasa, that also either internal krimi or external krimi or either macro or micro krimi, we can use that Krimikutara rasa also. Then Gandhaka Rasayana, that also very wonderful medicine, because most of the time if the patient having any inflammation condition, especially cellulitis and other reddish with fever and all other conditions, at that time we can use Gandhaka Rasayana, especially after the surgeries. While the surgeon has made any wound, then our responsibility to cure that wound as soon as possible without recurrence and without suffering or without complications. At that time we can use the same day also that Gandhaka Rasayana with combination of other medications. It will give very good benefits to the patients. Then Amrita Adi Guggulu, that also very good for actually in inflammation conditions, especially associated with fever and redness and likewise and severe pain conditions. Then Kanchanara Guggulu, that also giving very wonderful results, because while we are using Kanchanara, that wound will getting smaller very fastly and it will prevent some bleeding and all other conditions. So, we have to use that Kanchanara Guggulu also, but always I am telling, it is not only we are giving alone that medicine, it is a group of medicine, but it will have very good role for wound healing. Then Lakshadi Guggulu, that also, because lot of patients I am having because of fractures, they are having non-healing ulcers for long time. At that time we have to treat the fractures also. At that time especially we have to use Lakshadi Guggulu also. Then Punannavadi Guggulu, that also giving very wonderful results because of that chauffeur, that means inflammation. If not that chota, that means they are having swelling. Sometimes they are having fever, sometimes because of sometimes they are having hypertension or other conditions. For most of the conditions we can use that Punarnavadi Guggulu very nicely, and we are getting very good result while treating. Then Singanad Guggulu also having lot of I think you can see lot of actions according to the situation. We have to select the group of medications, then you can treat the patient nicely. And that, see the Chandra Prabha, I think I couldn't get able to finish all the ingredients also from this slide. That much ingredients they have, and they have that much lot of indications. So we can use in lot of places. Likewise this Chandra Prabha, not only wounds, even in a lot of places we can use very nicely and very successfully. Then Pachanamuta Guggulu, here that also mostly we are using as just Shamana and Tarpana Avastha. That means in the beginning, it means while we are doing that Shodhana Karma, we can't use that Pachanamrita Loha Guggulu, but while we are doing Shamana and Tarpana time, we can use this for especially blood purification and enhance the blood quality. Then Panchatitta Grita Guggulu also we can use the later part of the wound healing, that means in Ruhyamana Vrana. Then Trayodeshanka Guggulu. That also you can see lot of these medicines, they are having anti-inflammatory actions and analgesic actions, and I think you have seen some that lot of medicines, they have that combination of actions. Because of that we can use that all medicines in rational way as a combination, then they will give very good result. Then triple R Guggulu, that also very popular medicine while practicing surgery, because most of the post of that means after the surgery we can do that, we can give that triple R Guggulu to past wound healing, and the same time we can use mild laxative also, antimicrobial also. Likewise such a good actions they are having, and we can use in correct places. Then Chavana Prashavaleha, why we are giving this? Because the patient must be in good Tarpana condition. For that we have to give that Chavana mostly in the Tarpana stage. Then these are the success stories I have treated. That's what I wanted to discuss with you. This is the wound, actually it came I think before 2 years. That was the pricking wound. After that, that other hospitals, they have done instrumental debridements, and they have tried 2 months, and the wound was worsening day by day. Because of that they have given date for the amputation, but after coming to me, you can see the 6 months progress what I have done according to the good combination of good medicines in a good rational way, so that patient save his leg. This is mycetoma, that means that common name is Madura foot. I think you must not have heard this much. This is actually the indication of amputation. Most other medical systems, they are not having any medication for this. Only the final decision for this is amputation. For that also I have started actually with Uddhartana, then followed by Achapana, then Virechana karma, then I started Shamana karma, and the same way I have local treatments also done, especially what I have early mentioned, that Kapardaka Bhashma. Likewise I have used the meantime the later parts I have used Rogani Kash, and later I use that Yashada Bhashma, etc. Anyhow, within 2 months he cured, and I think it was before 4 years. Still the patient is coming to me for the follow up. No any recurrence up to now. This is necrotizing fasciitis. This also very severe case, because this also for indication of amputation. This patient also approached I think after 4 or 5 weeks later that started. Because of that our Ayurveda wonders, and especially Ayurveda medicines, I was able to treat, and he was cured that much from 4 months treatments. And this is sphenoidal sinus. This was a very wonderful case, because she has undergone 6 times surgery, but the 7th time she approves to me, that means for Ayurveda treatments. At that time she got cured within 3 weeks of that wound, but she told that last 6 times she suffered more than 3-4 months for wound heal. But while we were doing with Ayurveda treatments, she got healed that much within 3 weeks. But daily I have done dressing, including Matra Basti and local dressing as well as internal medications. Then cellulitis. Most of the time that cellulitis, that other medical systems, they are very afraid to treat, and for this patient also they have given the date for the amputation for this leg. But that patient approached to me, but within 3 weeks he got very nice result after Ayurveda treatments. Then Fonus gangrene. Actually this patient was approached to me for his fistula case. I don't know whether you can see or not in this side, he having one open, while we were treating for 1 week, at that time he developed that venous gangrene condition, but within 3 months, all Shastra karma and all other karmas I have followed and got all the good result. And one thing I want to mention, I have never used any allopathic medicine, antibiotic or any painkillers. All the cases I have treated only with Ayurveda medicine, with Ayurveda wonders. And this is a diabetic foot also. This also given the date for amputation before 3 years. That also while she was coming, it was full of stuff and pus, and just only cavities on her right foot. But after 9 months, she got very nice result, and up to now she is very well and she is coming for the follow up. And for her that diabetic condition also I gave medicine and it was very nicely managed. Then osteomyelitis case, this patient also approached to me around February this year. At that time also they have given the date for the amputation for this patient. For this patient also having full pus and slough, at that time I started Kapardika Bhashma internally, and around the wound I put that Dashanga Lepa with tamarind leaf juice likewise, and internally I have given lot of medicines in rational way, but while 3 months he got that much relief. And the summary, what I want to mention, most drugs having large number of ingredients, especially I mentioned here that rasa drugs, then each drugs having lot of actions. So some single drugs can use for many conditions. Then the minimum number of drugs gives various effects. Then correct combination of drugs gives more benefits with minimum time duration. With same drug can manage complications also. Cost effective treatment can implement, and very less side effects and harmful drugs interactions. Then conclusion, a wound can be managed successfully with 60 upakrama if chatuspada of therapeutics are ideal. Then wound will heal within short time when chikitsa methods used in proper time, in proper order with proper medicines, can prevent complications, amputation and recurrence with using of Ayurveda wound healing methods mentioned in Susutta Samhita, especially I mentioned as a surgeon. Thank you very much for the chance I have to you given me to present this presentation. Thank you and have a nice day.
Thank you very much, Madam. Dr. Priyadarshanee Gunarathne, Consultant Ayurveda Surgeon of Gampaha Vikramarachi Ayurveda Teaching Hospital, Yakala, Sri Lanka. So, Madam, for your valuable insights presented here at the 6th Rasashastra Sambhasha, we would like to felicitate you, and I would like to cordially invite co-chair of today's forum, Dr. S.L. Vevalvala, the Senior Lecturer and Head of Department of Ayurveda Basic Principles at the Faculty of Indigenous Medicine, Gampaha Vikramarachi, University of Indigenous Medicine. Thank you very much, Madam. And while listening to this tremendous lecture, I found the memory of one important sloka. Nigudanukta Leshokta Sandigdhartha Pradipika Sunischitarth Vibudahai Paribhasha Nigatyate. Thanks to Dhootapapeshwar Limited, we got the opportunity to share this immense knowledge that would be beneficial for us to proceed forward as successful physicians.